Yeah, Lisa, you can start now.
Okay. Good afternoon, everyone. I, Aliza Shahid, on behalf of Hood Welfare Society, welcomes you all in today's international panel discussion on the paradigm shift in the human rights discourse post-COVID-19 catastrophe. On 10 December, Human Rights Day is celebrated across the world every year. The date was chosen to honor the United Nations General Assembly's adoption and proclamation of the Universal Declaration of Human Rights UDHR in 1948, the first global enunciation of human rights. This year's Human Rights Day theme relates to COVID-19 pandemic and focuses the need to build better by ensuring human rights are the center to recovery efforts. We will reach our common global goals only if we are able to create equal opportunities for all, address the failures exposed and exploited by COVID-19. In the context of the commemoration of UDHR, the Hood Welfare Society has taken an initiative to provide a virtual platform for international panel discussion on the paradigm shift in the human rights discourse post COVID-19 catastrophe. Now, to give a brief about the Hood Welfare Society, I would like to invite Mr. Akhtar Hussain, Secretary of HWS. Over to you, Akhtar.
Thank you, Lisa. Thank you so much. I would like to thank everyone who have joined this webinar. Food Welfare Society is an NGO working on the field of nourishment. Our organization works for society in 5 different domains. We have divided our these domains in 5 ways. Firstly, is social nourishment. Then we have animal nourishment. Then we have medical nourishment. Then we have legal nourishment. And at last, we have student nourishment. With student nourishment as the main focus, we have initiated to create a bridge between the students and the society because through them we will achieve the objectives of the society. Our NGO's main focus is on no dependency factor. We like to serve independently through our resources, that is our knowledge. And we focus on the upliftment of vulnerable and undernourished region of the society without creating dependency. We don't want to be the beggar server. We have members from various fields, so without creating any dependency, we believe we all Hooters can change the society as a whole. We have been working hard inculcating skills among students so that they can be responsible citizens of this country. And we have also worked day and night to help the needy and the people who became dependent on us during lockdown. Now, I would like to introduce our organizing team. Firstly, we have Mr. Mohammad Wajid Khan. He is the convener for this event. Then we have Mr. Abhinav Srivastav. Then we have Mr. Ayush Kumar, Ms. Asma Parveen, and Ms. Aliza Shahid. Now, I would like to start this event with a share of Faiz Ahmad Faiz. गुलों में रंग भरे बाद नौ बहार चले गुलों में रंग भरे बाद नौ बहार चले चले भी जाओ के गुलशन का कारोबार चले. Today we have with us Dr. Shahab Shabbir, keynote speaker, who is an assistant professor of law at Maldives National University in the Republic of Maldives. He received his PhD in international environmental law. Besides PhD and LLM, he has also earned a few more scholastic credentials to boost his academic pursuits. He has PG Diploma in Mass Communication, Diploma in West Asian Studies, Diploma in Baha'i Studies, and Diploma in Evangelical Studies to his credit. Dr. Shahab is a full-time academic professional with over 7 years of teaching and research experience. Before joining in Maldives, he worked as a lecturer in law colleges in Meerut and in Aligarh, and also acted as a law professor in an MNC. Dr. Shahab is an ardent academician in legal studies, which is evident from his publications, conferences, papers, and presentations. He has published 14 research papers and 2 book chapters so far in the journals and edited books of national and international repute, and has presented his research at 29 conferences, symposiums, workshops, and seminars at local, national, and international levels. He had been invited to speak in Spain, Indonesia, Thailand, Bangladesh, and Sri Lanka, beside different institutions in Maldives and India. Dr. Shahab claims his expertise in jurisprudential studies of media, medical, and environmental laws. Currently, he is working on 2 books related to his asserted area of expertise. Then we have with us is Ms. Ummul Waraah, panel, Assistant Professor, Galgotias University, School of Law. Then we have Mr. Mohammad Wajid Khan, convener and Assistant Professor, Global Law University, India. He is a member of CIRIP, Taylor's University, Malaysia. He's a doctoral fellow at ICESSR. He is associated with this NGO as editor-in-chief, editorial board of Punch. Now I would like to invite Dr. Shahab on the platform. Thank you, sir. Over to you.
Thank you. Thank you very much, Akhtar. I hope I'm audible to you all, right?
Yes,
Am
sir.
I?
Yes, sir, you are.
Thank you very much. So, I will start. And as Akhtar has pointed out about my academic credentials and all, and it is my duty to introduce myself once again. I'm Dr. Shahab, and basically, I'm an league that is, I got opportunities from Aligarh Muslim University in UP, but right now, I'm teaching at Maldives National University at present. Before I begin, I would like to express my profound gratitude to the Hoot Welfare Society, and particularly to Wajid Khan, who is he's a gem of a person. And Wajid Khan and I had been in a long contact, and and it's like it would be an exaggeration if I'm going to speak a lot about him, but he's just a gem of a person. I'm thankful to Wajid that you have invited me to speak on a very important issue today. Yeah, and that is the human rights, the paradigm shift in the discourse of human rights post COVID-19. Now, the point is that since I've got paucity of time and I'm not supposed to speak a lot, otherwise this topic is such that you are just going to speak and speak and speak, and still you are yet to come, on some particular kind of result. So I would like to point out some very important and those areas which we, particularly the young people, we need to know. So to start with, it's all about the definition of human rights, as we all must be knowing, because I believe that most of us here on the panel, as well as on the viewer side, we are from the legal background, or if not from the legal background, but we are into some kind of human rights things and working for the human welfare. So human rights are actually the inalienable rights. They are the rights which cannot be taken away from the people. And it's like, once somebody is born in a human society, the moment he is born, the right goes to stick with his person. So even in our courts have recognized the human rights to such an extent that even if a child who is unborn still to get his birth, he gets the human rights before his birth over there. There are numerous cases that our courts have decided before, and it is so that's why it's such an inalienable rights. And this human rights actually is based on three tripartite level. The first is civil rights, then political rights, and then economic rights. So civil rights, this is the definition part that I'm going to tell you. This is the first part of my lecture or keynote lecture. It's like I'll be talking about the definition part, then I'll be talking about the HR issues related to COVID-19 pandemic. Then I'll look forward for the HR, that is human rights response to the COVID-19, and then the new areas that have got emerged. That will actually tell you what this paradigm shift is all about. So these three rights, that is civil rights, political rights, and economic rights, are inalienable rights to a human being once he is born in the human society. Now the issues are that what kind of rights that we are actually primarily we talk in the human rights section when it comes to the discussion. They are like freedom of speech and expression is there, then right to health, that is also very important right to health is there. Then when we talk about the human rights, it's like freedom from discrimination, that is another important human right. Then freedom of information, yeah, to get informed, that is an inalienable human right. You are supposed to get informed, right? Then freedom from arbitrariness, that is arbitrary arrest and detention. Then freedom of movement. And now you just can connect it, like freedom when I'm talking about freedom of movement, the first thing, the word that comes in our mind is about lockdown, right? So I'll be talking about all these issues, and I'll try to wind up very much in time because the other speaker must be waiting for her turn as well. So then the freedom of assembly, again the lockdown issue will come. Freedom of religion and practicing the culture and customs, right? Then the right to privacy, minority rights, then the right to family life, right to have economic process, right to have livelihood, right to all these kind of rights are there. That is generally they're being discussed in human rights section. Now, the point is that before COVID-19, all these points, all these rights that I enumerated a while ago, these were very much into discussion, and a lot of human rights conventions and seminars and researches and UN conventions and all these state actors, non-state actors, all these area. I mean, all these you can say parties. They had a full you can say an extravagant kind of view of human rights, right? And it was going very well until this pandemic came. This pandemic came, and this pandemic actually came with two unique aspects. I'm talking about this COVID-19, right? This COVID-19 or the coronavirus disease or infection came with two unique aspects. And why it is unique? Because it's a failure and it's a success. When it comes to the discourse of human rights, it's a failure and it's a success at the same time. Failure and a success. Why? I'll talk about a failure in the success in the positive sense and failure in the problematic sense. So you can take it like this: that COVID-19 appeared as a problematic factor as well as it appeared as a positive factor to the human rights discourses. Now, what is the positive factor and what is the problematic factor? It's here. Positive factor was that all those areas of human rights which were not being given due considerations, they came out. All of a sudden, they spurted out. All of a sudden, they became talk of the town. All of a sudden, they became, the front line issue of discussion, and all those areas which were being discussed, and they were actually bringing some kind of failure to the idea of human rights protection, human rights preservation. They just got the backbench, and those areas they come forward. What are those areas? I'll be talking about that. And it was the positive aspect. Problematic aspect was that the policies, the government policies of the world over, I'm talking about the international government, I'm talking about the local governments, I'm talking about the respective state and country governments. All these governments, they were going with the policies. They found it very difficult to make changes in those policies because the jurisprudential aspect of human rights was into question. The jurisprudential aspect of HR, that is human rights, was in question. Mind it, I'll be using the acronym HR time and again. So henceforth, HR means human rights, not human resources. All right, because generally in corporate world, it's human resources. So positive and problematic, both aspects were over there. Now, what happened? What were those? I mean, who were those? The communities, the groups who were highly at risk. They were like first one. The first and foremost was the poor people. We have seen it in our country. The poor people, they suffered the most. The poor people, right? Because and they suffered in the sense that poverty was not being discussed in general as a part of the human rights discourses. They were being discussed as a part of the policy of the government, economic policy or political policy, whatever. You see, in our country, and let me, get this liberty to speak this thing, that all the political parties in our country, they used to exploit poverty for the political ends, for the menial ends, right? Now, the point was that poverty or the people living below the poverty line were never seen as that they could be a potential human rights discourse point. But after COVID came, these people, the poverty-stricken people, they emerged as an important human rights, discourse point, you can say like that, right? Then second was ethnic and religious minority. I'd like to tell you that ethnic and religious minorities were always a part of human rights discourse. This is something different. They were always a part of human rights discourses world over, right? But the point was that the aspect in which they've been seen now, because racism in many countries was at the peak, at the pinnacle, and the human rights you can say observers or the champions of human rights had an altogether different aspect. They just would be thinking that, okay, giving the rights to the minorities in the respective countries, giving their rights, it's just enough that they are being given with their right to food, their right to livelihood, or their right to life and personal liberty. That's it. But then this COVID pandemic it taught us a lesson that the minorities are also a part, the same part, without even having an ounce of difference. They are the part of the mainstream society. Why they are being alienated just by saying that they are minority or they are different, ethnically different? Say, for instance, in India, like these which we call as Adivasis, right? These ethnic people, Adivasis, the Aboriginals. Like, you see what happened. I'll tell you, instance. The pandemic, when it is, it affected India, the whole Indian country, I mean nation, was into the lockdown, and the government, I'll appreciate every state government, even the central government. I appreciate that, they did what they could have done at that time. They did their best. But then some of the areas were really, like, they were untouched, and the government could have done nothing. You know why? Because the policies were not there. They are always only into the discussions and the papers, not into the practical aspects. Like, these Maowadi area, the moist stricken area of Chhattisgarh, of Jharkhand, then of some parts of UP as well, like Sonbhadra areas and all, then Andaman Nicobar Islands, then some parts of Orissa, then parts of Northeast, right, like Nagaland and Arunachal Pradesh. Arunachal Pradesh has got a special status in the Indian legal system, that it's a part of India, it's an inalienable part of India, but still Arunachal Pradesh has got some special provisions, like erstwhile J&K used to have with this Article 370. Right now, what happened? The general policies that were applied to the whole country in the form of lockdown and other measures, they turn out to be disaster for these people. You might be hearing time and again about the news that comes from this Maoist area of or highly affected Maoist area of Chhattisgarh, like Jashpur, Jagdalpur, and Bastar, and all these Maoist area. What happened to these people? Not every ethnic person, not every Adivasi is a Maoist, right? Not every Adivasi is a Maoist. The government is actually trying to rehabilitate them. But what happened when the pandemic came? The government, the system, the whole system focused upon the people living in the mainstream, and these people were, they got lagged behind. Then what happened into pandemic? We have seen, like, not in India, even in many parts of the world. I'm talking about not India or Indian subcontinent, many parts of the world, even in Australia or New Zealand. The Maori is the ethnic community in New Zealand, and New Zealand is one of the champion of human rights. You might have heard about Jacinda Ardern, the very glorious Prime Minister of New Zealand. She has been termed as the champion of human rights, but by even all the you can say stakeholders and all these popular human right figures, right? But still, she admitted at one point of time, if you are going through these reports, that she admitted that yes, we have failed in delivering to the Maori, that is our Aboriginal people. In New Zealand, it's not a large part. I mean, it's a big population. It's a chunk of population. It's a small pocket of population of Aborigines, that's Maori. Then in Australia as well. Then in Mexico. Then if I'm clearly remembering, it's like about in USA also. Such a great champion of human rights. USA also failed. But a lot of people, they are saying that it failed because the election process were over there. But do you think that election process can affect the human rights deliverance? But it affected, right? In India also, in Pakistan also, in all the, so the whole world got affected, and it actually it led these ideas to emerge, that okay, these areas are also there which are very much into our discourse, but they are being ignored upon, right? Then women, yes, women got largely discriminated, to be very, it's a very sorry state of affairs that might be our media hasn't shown. Although I would like to appreciate the world government, they tried to empower the women. But what happened when this crisis came? It's just like in our Hindi language, we used to say haath pav phul jate, right? When we face some such kind of crisis in our life, so what happens? Hamare haath pav phul jate, right? This happened with the world government. All of a sudden it came. All of a sudden there were a lot of all the countries, they just in a matter of hours, they announced for this lockdown things and all. And what happened? Then they were not ready. They were not ready. They were not prepared. They were just, they declared this lockdown, or they declared all the kind of you can say limitations upon the movement, upon any kind of freedom, because they were believing that all of them have got good HR, human rights policies, and it will work. But it didn't work. It didn't work because the policies had some loopholes, and this is what actually it changed the whole paradigm of the human rights discourse. And this is what I used to call it as paradigm shift in the discourse, right? Now another point is like people with disabilities. Do you know that what kind of disaster, the terrific life these people with disabilities they led in the whole lockdown period? Because they were confined to the four walls. Lockdown, because it was universal lockdown, they were confined to the four walls. Nobody cared. I'm not talking about, because even the NGOs people like you people are doing a very good job, right? But even you were not also allowed to go outside and take care of these people. Only the frontline workers and the doctors, right? Frontline workers includes these police personnel, and then a few even NGOs which are they are working in the area of health. They were allowed to go outside. Otherwise, people from very good and very active philanthropic organizations were also put behind the four walls of their homes and houses. So people with disabilities, they faced a lot of problems. While I was doing research, I have prepared two research papers based on the lockdown, the legal aspects of the lockdown and its aftermath in Maldives and in India as well. So while I was researching for these papers are ready and they're about to publish. So inshallah soon they'll get published. So what I found in my research, since it's an unpublished research, so I'm not going to open a lot of avenues of it, but just a glimpse of that what I found that countries or the legal systems which claim, and they are even popular in legal spheres, that they have taken care of their people, they also fail to deliver to these people of whom I'm enlisting here, like like women. Yeah, but it's like the media, as you better know, all of you better know, it's something the media always speaks from the part of the government, whoever is in the government. It's not like which a person is there, but whoever runs the government, the media speaks on their behalf. So media failed totally to deliver, to talk about these people. And what happened, those who had genuine concerns for them, even they failed. That's why these things came into discussion. Now this is a research. Now then, older people, my dear friends, older people, they suffered a lot, and it's a very sorry state of affair that these elderly people, yeah, I'm not talking about all the elderly people, and if I'm talking about the context of my country, that is India, not all the elderly people, but most of them. You see, I'll just let you to think for a while that before the lockdown period, that is talking about February 2020 and before era, if you are going to a railway station, you would have seen a lot of old people, destituted, poor, right, sick, old, most of them who are old, particularly the women, old women, right? And you could have seen them sleeping here and there and somehow struggling to survive, somehow struggling to live their life. Just think for a while that after the lockdown happened, because before the lockdown, some good people, because there are a lot of good people in the world, and I mean most of the people are good, right? They used to give them food, money, or they would help them, and that's why they were able to survive. But what happened after lockdown? Nobody was able to go outside, right? Even I've seen in Male, that is the capital city of Maldives, where I'm staying at present, right? So these people, they're you can say these astray animals, particularly in Malay, there's no any other astray animal other than cats, like so you can find only two kinds of animals. First is human being, that is social animal, and other is cats. No any other pets can be found on the streets of Malay. And these cats, they started dying because people used to feed them. And then what happened? The government passed an order. So I salute Maldivian government, because they passed an order. The president passed a special order and giving this, I mean, ordering these some philanthropic organizations to come out, right, by giving them some kind of permits and all the permissions, and so the license and permits, and they were made to come out and to feed these astray animals, because thousands of cats can be seen roaming here and there around the streets of Male, capital city. So what happened? I'm talking about a government which actually tried the best. But what happened to the older elder people and the destituted people? The same happened with the poor people, like, right? So elder people. Then one more very, you can say, vulnerable community. And as a human rights student, as a teacher of human rights, I would like to say this vulnerable community is LGBT. I hope you might be knowing about who these LGBT people are all about. Like, these people, they've got a different kind of orientation, particularly sexual orientation, right? Now, these LGBT people, they also got discriminated a lot. Uh, The good thing is that in Asian subcontinent, the reports of discrimination against LGBT people were very less. I don't know. Might be the factor. Might be that the media or the government doesn't want to come out with the reports upon them, because very less study are being done upon their status and all. But in other countries where the studies are, they constantly do the studies upon these LGBT people. They're also human beings. You cannot discriminate them just because their orientation is different, right? Then came the migrants and the refugees. My dear friends, at the outset of this lecture, I talked about migrant workers, right? So I just merged them into the poor people's group. But then we cannot, we must not forget that the migrants are people who are not poor in the real senses. They're in the real senses, they're not poor, right? They're the migrants. So they were well fed, they were well dressed, they were very much doing very well when there was no pandemic, when there was no any such kind of issue. But all of a sudden, this crisis came, this catastrophe led them to leave their place of work, right, and to go back to their original place, right, from where they belong to. So we have seen, everybody is very much aware about the kind of disaster, the terrible life that they led. And we have seen, like, months around these news, they made, rounds upon the social media and the national media, even on the international media, that what is the pathetic condition of these migrant workers. You would have seen such, heart-wrenching images were coming, like having 2 months old baby in the hand, and the father has decided to cover like around 1,000 kilometers of distance, going from Delhi to somewhere in Bihar, or somewhere in West Bengal, or even to Assam, and having 2 months baby in the lap. The mother is there, and then and in the name of belonging, they've just got one bicycle, and then a few clothes like that. And many of them measured, but then a few of them got failed. A few of them died as well. Now this is, you see what happened. Even a single person is dying because the policy of the government was not there in their favor. It means that the human rights exercise has got failed, and the government has got failed. I'm going to exercise this liberty very much to say that the government anywhere, I'm not talking about the government of a particular country or my country or any other country, anywhere in the world, be it a country as small as Vatican City, or be it a country as big as Russia or China or India, if the government, if even one person has suffered because of the policy of the government, it means the government has totally failed. And we have seen most of the countries, the governments have got failed. And unfortunately, in that list, our country also comes and appears on the top even, right? Then, last but not the least, the party that was the most affected party, that changed the course of discussion and any kind of research upon human rights, they were children. My dear friends, children. Even to this date, while I'm speaking to you here on this video conference, the children are suffering. They're not able to go to the school. Yes, and I'm talking about the general children of my country. If I'm going to categorize them into poor children, you just can't imagine the kind of problems they are facing. You could see a lot of children who were just the payment dealers. I remember a case at this very juncture, Olga Tellis versus State of Bombay, where the Supreme Court of India, in the light of the Article 21 of the Constitution, Supreme Court of India, what it pointed out, that the right to have life with dignified, a right to life with dignified life, right, and liberty with dignity. So both the things, liberty with dignity, is the ambit of Article 21. It's the duty of the government to ensure that. Can you think for a while, all these people whom I have listed, like poor people, like ethnic religious minority, or women, or disabled people, or older, or LGBT, migrants, refugees, children, do you really think that they were able to have a dignified life, when all these things came, like catastrophe, or this crisis came? The point was that no, because the governments were not ready. And why the governments were not ready? Because they turned lazy. They thought that what their policies are, I'm sorry to say, my apologies, but many of the HR policies, human rights policies, they're age-old policies. Sometimes I feel like it's they have directly taken it from Magna Carta and they have applied it to the people without giving it a second thought. Is this the way the government should act? Is this the way the government should deal with the people? The answer is plain no, right? So what happened, these things when they appeared, they used to be over there in our society, in our day-to-day life. They were very much there, the issues were there, right? But these issues never came into, limelight. They were not highlighted deliberately or indeliberately. I won't go deep inside that issue, that discourse, deliberately or indeliberately, but they were not highlighted in general. What happened now, this crisis, that's why I said it's a pleasant crisis. It's a problematic crisis as well. Now, what are these new areas emerged? These were the issues, right? These were the risk area. The group of people who were at risk. Sorry, the group of people who were at risk, and this gave birth to a lot of new discourses that's surely gonna change, because these 2 3 5 15 16 or 100 or 200 seminars or webinars cannot change the course, but it will change only when we decide to start change from ourselves. So what could be the areas, and we decide to start asking, as let's assume that let's wear the gown, the shroud of stakeholdership, and let's ask from our establishment that what they are going to do, what they are doing, like the areas that I was about to talk about, like it could be the emerged areas. I'm going to speak for next 2 3 4 minutes, I'm sorry, because I think it's a lot of time I've taken, another speaker is also waiting. Yeah. So first thing first is to keep the public informed. Yes, we have to ask from our establishment. I'm not using the term government, but yes, somehow it's pointing out to that area. So we have to ask from them that let the people be informed. You know what happened during the times of crisis? The government wanted to save its image and credit. So what happened? The media was blatantly used to forward the propaganda, and we have seen in many countries what happened, many countries including ours, like that the vulnerable groups were targeted, and just to put a cover upon the failure of the policies of the government and the establishment, these vulnerable groups were made scapegoats, that they are responsible for spreading this virus, and they should be banned and all, blah blah blah, like that, right? So you might be knowing about, right? So let the people be informed. This area of individual information is one of the new areas that has emerged as per my research after the COVID-19 came, right? Then right to health was very much over there, as I discussed before. Right to health was there, but inside right to health, it was like, okay, just you are going to get treatment, the government provides you subsidized medicines, and then you are done up with that. You have got some kind of government hospitals like Sadar hospitals or some Zilla hospitals and all. We have got, and we used to think that okay, it's done up now, right to health has been addressed adequately by the government, so it is done up. No, it's not like that. This pandemic has given a new aspect of what right to health is all about. It's providing test and treatment to each and every individual, and the government should take into note that each and every individual is, whether it's a big country like India or Russia, or there is a small country like Maldives or Vatican City, the government is the duty of the government to take note that each and every citizen of the country is getting treatment. That's why you see when the vaccines are being, now it's like the musings are there in the market that the vaccine will arrive soon, right? And what the government policy is, I'm talking about India, that okay, we are going to make a kind of hierarchy that who are going to get the vaccine first. There would be the doctors, and then nurses, and then frontline workers, administrative people, and then common people, like that, right? Okay, it's all right, fine. If they're going to make the policy, it's okay. I'm not going to oppose this policy, but there has to be policy. But the thing is that the person who is standing in the last of the line should also get the vaccine, like as the person who got it at first. It might take a little time. We should give the government, we should sell the time to the government, but yeah, it has to be rest assured, right? So second area of human rights that has emerged after COVID-19 is that each and every individual. I remember Akhtar, he started with a very good share of Faiz or whom. So at this point of time, at this very juncture, giving treatment to every individual, I remember a share, since I am from Aligarh Muslim University. It's like इस राज को एक मर्द फिरंगी ने किया फाश, हर चंद के दाना इसे खोला नहीं करते, जमहूरियत है वो तर्ज हुकूमत के जिसमें बंदों को गिना करते हैं तौला नहीं करते, right? बंदों को गिना करते means every individual, right?
Thank you
Every individual,
for this scene.
yeah. Yeah, I'm going to wind up in 3 4 minutes. 3 minutes, please. Right? Then another important area is, like, we used to say that, okay, the government is working, and we appreciate it. Okay, we should appreciate also. It's not like every time we are going to criticize them. But then the point is that we are supposed to take this thing into account as an individual, as every citizen, that how much, not only providing vaccines to everyone, but how much the government is working towards reducing the risk without hampering the human rights. They reduced the risk. They've taken the good step of lockdown, but were they successful in providing each and every individual their rights? Were they able to satisfy every citizen of the country as well as every resident of the country? Those who are residing, might be from outside the country, or those who are not citizens, were they able to deliver them their basic human rights? No, I don't think so. In lockdown, it was not possible. You see, the first thing first, freedom of movement, it was not there, right? It means that, but we can say that, okay, it's an emergency situation. But in emergency situation, fundamental rights cannot be, even in emergency situation. This was Shivkant Shukla case, ADM Jabalpur versus Shivkant Shukla case of Supreme Court, right? It clearly said that even in the time of exigency and emergency, even fundamental rights cannot be sorry, fundamental rights cannot be taken from the human being, from the people or the citizens of the country, right? But the right to movement was taken away. And funny thing was that the right to movement, later on when they revised it, they said that from 8 in the night to 6 in the until 6 in the morning, you won't be moving around, as if the coronavirus comes only in the night and goes back away in the morning, and then for the whole day it's like that, right? You see, there was election in Bihar, there were election in a few other places in the country, and there was no any practice, or there was no any concerns for the social distancing, for mask and all these things, right? And the elections were done peacefully, because this is something very weird to say, but is it like the human rights have gone back, and the priority is to get the seat, priority is to get the chair and the power? This is something, this our leaders have shown to us, and this, I think, it's a very unwelcoming step, and this should be revised very much, into very honest manner. Now then, another area that got somehow discussed before as well, but COVID-19 made it more intrinsic to be discussed, that is right to access to livelihood, to water, clear water and clean water and sanitation, and then access to a clean environment. What happened because of the lockdown? The cleanliness workers, they were also made to go, to be confined to the four walls of their homes. And what happened because of this? A lot of the cleanliness drive got a setback in the country. The cleanliness drive, it got a setback in the country, and in India particularly, you see that we are champions in polluting our environment, be it our local environment, be it our sky environment, the air environment, the climate, or whatever. We are champion in that. And sorry to say, I'm also one of, like you, I'm also one of the proud Indian, but we are mannerless in that sense. I have traveled widely, in the world, to almost all the corners of the world, and I have come to this conclusion that we are really mannerless fellows. We just have lip service of saying that our country is our mother, but we do not let any stone unturned to make it dirty. The best we could do, we used to do it. And I'm not going to talk in detail about that, because all of you better know it's something which can be seen in the practical senses. So access to livelihood, to clean water and sanitation and clean environment, that has emerged, and could be, I believe that in next 10 years is going to be a separate kind of human rights. Access to livelihood will become a separate kind of human right. It won't be coming to right to life and personal liberty. And this message has been delivered by COVID-19 only. Then economic fallout was there. Most of the countries still, they're suffering. Our country is also suffering a very heavy economic fallout, right? And it has given a message, that is COVID-19. And I'm thankful to COVID-19 that it has given a message that if you are just going to take economy not in a serious manner, and if you are going to trust those who just do mere lip services, then you are not going to suffer only, but you are going to make your generations suffer for their generations to come. Economic fallout has been there. Most of the countries in the world, they are trying to recover, and but then there are few other countries as well. They are not thinking it as, they're just thinking it as a daily business. But let me tell you that economic fallout has badly affected the human rights issues, and badly affected the human rights process and discourses world over. And the pandemic has told us that economic cannot be taken in light manner. Economic process is directly connected and related to the human rights issues. Then three more points. Psychological support is also very important. A lot of people, they committed suicide, although they were getting food, they were getting all those things that are necessary to live a good life. Then they committed suicide. You know why? And I'd like to point out the SSR suicide case, that is Sushant Singh Rajput, a very promising, very handsome, very promising young actor, and a very nice actor. And personally, I also used to adore him, and I was one of his fan. And when he committed suicide, I'm not going to say that he committed suicide because of the lockdown or because of the pandemic, but definitely some of the factors, a few factors of this pandemic must be also there in his suicide, right? And there can be another important factors as well. And media try to make media trial and try to divert the issues, but whatever it is that. But pandemic must have one of the part in the claim of his suicide. Then education, right to education, has been seen as a fundamental right, as a human right, but never been taken seriously. Now this whole pandemic has, the pandemic has changed the whole discourse of education. You see, the learning process has been changed. You see what happened to this issue of online learning. Even to at this very moment of time, we are having our kids, our children, they are very much into online learning, but the kind of personality development which they used to get while going to the school, having all these practical aspects of how to live in a society, how to live with your colleagues or friends, how to behave with them, they have been devoid of it. And this is again another blow on the human rights, particularly the rights of these children. Not for us, okay, we have crossed the maturity level even, but what about the kids? They are still into learning phase, and definitely they are going to suffer a lot. The kind of learning and education which we have got in our childhood days, or which we have got when we were like them, that kind of learning they're not going to get. And God forbid, if this pandemic is going to continue for long, which I wish must not, but if it's going to continue for long, then God forbid, the generations are going to suffer a lot. And that's why the COVID is giving a message to the policymakers, to the stakeholders, to the people at large, to the governments, that try to make an inclusive policy and particularly focus upon the learning, not only education. Mind it, education and learning are two different things. So not only education, so because imparting education is okay, you just are supposed to get a mobile phone, it's done. Although in the country, not everybody has got a mobile phone, not everybody can afford, not every parent can afford, and a lot of kids, a lot of children, particularly from the poor or village background, even if they are able to afford, but then there are signal issues, network issues are there. So it's grossly affecting, and it's grossly affecting the human rights process, right? Then domestic violence. Yes, this pandemic, when it lodged the people inside their homes for long, domestic violence was on rise. In my research paper, I have found a whole 2 paragraphs have been dedicated to domestic violence. And the countries or the societies which were seen as very peaceful societies, they also saw a lot of domestic violence. I won't take the names because I don't want to bring any disrepute to any particular community, but sorry, but there were a few communities even in India and other countries who were known for their peacefulness inside home and outside. And when we did the research, when we got with the survey, it was like, it was an eye opener that because of the lockdown issues and all, the domestic violence was on the rise, and surprisingly to those people who were known as comparatively peaceful. Then racism was also on the rise. So I think I've taken a lot of time. I'd like to stop here by saying that, the human rights discourses will run forever in the human society. Until the last human being is there on this planet. Even the last human being will discuss, if not with the fellow human being, if he's the last, he will discuss it, or he will take the course, he'll get the importance, he won't deny the importance of human rights, even if he is the last person on this planet. So human rights are inalienable things, but the time has come, the time has arrived particularly for the policymakers, for the stakeholders, for the people around the world, for the you can say aware and blessed citizens like you and me. Its time has come to question, to research, to focus, to concentrate, to observe all these things, that the message that is loud and clear, which is loud and clear. This message is loud and clear, and it has been given by the COVID-19 pandemic. Although it's a problematic phase we are, having this time, but we cannot deny that it has opened a lot of new avenues of human rights discourses, a few of which I presented before you people right now, and then there can be a lot others as well. I think my another able speaker is waiting to present all those other avenues which I might have missed or might have not been able to present here. So thank you very much for your patience listening. Thank you very much for a very nice audience, and thank you very much for giving me a chance to speak as a keynote speaker here at this very glorious forum. Thank you very much, everybody.
Thank you, sir, for your valuable words. I request the viewers, if you have any query or you want to ask something, you can put it in comment box and that will be taken at the end of the session. Now, moving forward to another speaker, I would like to quote a share here. हजारों साल नरगिस अपनी बेनुरी पे रोती है, बड़ी मुश्किल से होते हैं चमन में दीदावर पैदा. We have with us Miss Ummul Waraah, panel speaker. Over to you, ma'am.
Thank you so much, Aliza, and thank you for such a nice share, because I love that share personally, because I'm also in a league, so obviously it's a kind of hereditary in our nature. So firstly, I would like to thank your society for inviting me, and also Vajid sir, because he personally pursued me and just called me and just asked me that, ma'am, our society is a recognized society, and also we are working on certain kind of domains. So in the on the occasion of human rights, so just put a kind of brief value about what is human rights and what is the scenario of human rights in the present era. So, as Dr. Shahab have rightfully put forward many contingencies and also many contentions in regard to human rights already, I will just give you up firstly a quick brief, because maybe some of the audience are from not from law background, or I can say from first years or second years. So, firstly, I will just let you know that what we understand by the term human rights. Okay, so the human right is the concept which is available in our atmosphere or in our society from the very inception. Though we have recognized it via UDHR in 1948, but it was there, like it was there in the air, I can say. So a person is eligible, or I can say a person have certain kinds of rights by virtue of birth, in which he can or she can avail all such other rights in regard to that. This is the basic reasoning, and the human rights are of such nature which cannot be alienated. It means it cannot be transferred to some other person, and it belongs solely to you. In pursuant to our UDHR 1948, two more conventions were recognized in 1966, international related to civil and political rights, and then economic, social, and cultural rights. So some of the basic aspects as included in the civil and political rights, as well as in economic and social and cultural rights, you will find in our Constitution of India that many of these rights have been easily recognized or easily available, or even though if the Constitution of India is not recognizing it impliedly, but the Indian courts have recognized it via principle of precedence. We are following different rules and different interpretations has been given to the term human rights. Okay, so if we will look into our Constitution of India, how it looks like, and why we are recognizing and or why we are according ourselves to human rights. If you will go through Article 51C, what does it say? It says that India as a party to any kind of agreement or any kind of international convention must foster respect to the conventions or the agreements it accorded to or it rectified into. So India was a party, or I can say India is a party to the UDHR and other two conventions. So there was a primary responsibility of India to give consideration to human rights. In the year, though I can say it takes much of time after recognition, in the year 1993, we recognized the National Human Rights Commission, then afterward States Human Rights Commission, and so on. So this how we recognized the concept of human rights in Indian domain. So if we will look into the present era, the effect of COVID-19, there are certain, although the human rights have diverse areas or diverse dimensions which involves human rights, which involves contentions or reasonings, or I can say the many areas were broken or many areas become paralyzed in the era of COVID-19. But there were some major areas which I want to put focus on, which were highly vulnerable, or I can say that highly ignored. In the era of COVID-19, what was the impact of COVID-19 outbreak? The impact of COVID-19 outbreak is, in my perspective, it's not only negative in nature, but somehow it is also positive in nature. For example, if you have been through, obviously some of you must been on Instagrams, obviously. So if you have been through the media pages, what you will see that there are so many stories included in on our Instagrams, which says that someone is cooking something, someone is making something at home, someone is doing DIY, which is by do it yourself. So by doing such kind of activities, what we are trying to do, by making food at home, by cleaning our houses, by doing some kind of interior designing at home, by making something unique, or by establishing or by using some kind of media platform for further letting it for moving it forward, what we are trying to do, we are trying to do, or we are trying impliedly, we are recognizing these kind of categories, that those persons were important to ourselves, those persons have some kind of recognitions in our lives. If someone is making food, if an entrepreneur is making food at home, what that person is recognizing, impliedly that I was equipped, I was never in that scenario when I was making any kind of, or when I was involved into any kind of home course. But due to lockdown, or I can say due to certain kinds of restrictions, due to which the maids were not allowed to move forward or to come out from their houses, we there was no other option than making comfortable ourselves by making food, or by doing homeworks like washing clothes, or mopping, or clothing, or something like that. We didn't recognize them explicitly. Previously we were thinking about that, okay, we are paying to maids and they are liable and they have certain kinds of duties to come and clean our houses. But in the era of COVID-19, we have changed our perspective to look into. I can say that the era of COVID-19, or the outbreak of COVID-19, has put forward many dimensions, many branches to a particular subject. Further branches have been divided. For example, the first branch which I want to focus on is the right to health. Obviously, the right to health have been recognized in our Constitution of India impliedly. Also, it has been a part of its state directive principle of state responsibilities, DPSPs, where it says that we must be into a clean environment, and also the state must protect its citizens to live into a healthy and clean environment. But previously, the concept of healthy and clean environment was only potable water, sanitization. These much were the perspective of healthy and clean environment. But nowadays, in the era of, or I can say after the outbreak of COVID-19, the concept of clean environment is where the sanitization should be of such high standards, where we will not be contaminated by any other person suffering from COVID-19 virus. The concept, or I can say the subject matter of a particular domain has been elaborated. We have not only in the era, or we are not only in the stage where when we are talking about roti kapda or makan, we are talking about many more things. For example, if we are talking about education, previously for us educate previously what we were thinking, that education means a person must be I can say that a person should be having certain kinds of resources where he or she can study, or I can say primary education was compulsory. This was the notion we were having previously, that if the government is providing free education to children below 14 years, it means the government is doing its duty. But presently, what we don't need, because we are not going to schools. Presently, what is the need of these students? The need of these students are, because every student is different, we are living in a dynamic society, we are not living in a static society. So in view of that, because we are living in a dynamic society, every student or every person belongs to a certain kind of family background. Maybe that person, maybe that student want to learn, but that person or that student is not equipped with laptops, that student is not equipped with mobile phones, wi-fi's, or mobile data. Suppose a student was solely basing her education on scholarship. So what is the resort in this situation? So our concept, our basic notions of education have changed now. Previously, labor system was like the entrepreneurs or the businessmen or the major establishments, they were thinking that if we are paying to laborers, that this means that the laborers are kind of bonded by it, that they need to do certain kinds of duties. But now the concept of labor has been changed. What we have done to labor classes, the laborers, obviously many of you have gone through newses. What we have seen in the first stage, when the first lockdown was declared, and in the mid of second lockdown, the laborers was literally walking, and they were not having any kind of resources to reach their home. They were not having trains, they were not having buses or any kind of conveyances. You must have seen a particular video where a lady has gone through labor pain and she delivered a kid, a child, at that point of time. So what we were doing at that time as a government, what we were doing at that time as an establishment, what we were doing at that point of time as a person. Because what is human rights? Human rights, as I have already told you in the introductory part, that human rights is not something which we get into by certain kind of reason. Like for example, in case of contract, we get certain kinds of rights and obligations by entering into a contract. Because we entered into a contract, we are liable for certain kinds of rights and duties. But human rights is the basic need or the basic aspects of life. So we have ignored what we have ignored in the previous decades, or what we have ignored till the I can say till the half of March. What we were ignoring has become the major issues, major contradictions, or major contentions of our present society in the era of COVID-19. The education system has completely different now. The approaches of laborers have been changed. The skills, or I can say the capabilities of the previously there was a clear distinction between the gender work. Obviously you have seen from your childhood that your mother is quite involved in the kitchen and your father is quite involved in the uh, outside work, like any kind of home, I can say that earning money or something like that. But in the present era, because everyone is inside house, inside home, so what they are trying to do, they are trying to make a balance. There are two aspects to it, which sir also, Dr. Shahab sir also recognized that. Firstly, there presently there is gender neutrality, I can say, that where also the men's are proceeding towards kitchen, they are also helping out in some kind of housework and all that stuff. But on the second hand, which is a negative impact of this, is that women are suffering so much of domestic violence, because what they can see, or I can say that previously the men's who were in their offices, they were, obviously everyone goes through certain kind of frustrations or certain kind of irritability due to work nature or work pressure, I can say. But they used to handle it in a different environment or a different manner. But presently, because they are living in their houses, they used to uh, outburst their anger, outburst their anxiety issues in front of their, either their children or their wives. So this era has also impacted the family issues, which have somehow positive aspect. Like I have told you, the gender neutrality concept has been increased. Also, on the other side, where the person has been in certain kind of frustration or irritability issues, that person has put forward certain violence upon the women. Also, if you have gone through some Nigerian newses, or there was some Iranian women who were also complaining regarding these issues. Next issue which I want to discuss is our prisoners. Like many persons, many prisoners are uh, many cap I can say that many are under trials. So what is the procedure, or what was the mode behind it, how we secured their position? Because as I can say, we do discrimination, but coronavirus or any kind of infection does not make any kind of discrimination. For coronavirus, everybody is same. Like COVID-19 and virus will not see the or will not consider that, oh, someone belongs to a different kind of category, or someone is from certain kinds of financial background, so I will leave that person. Everyone is same in front of coronavirus. So in the I can say that in the matter of persons who are living in the jails, as if many of you have been through certain kinds of jail visits for certain NGO kinds of works or certain kinds of internships you have been through, you must have seen that there are only certain jails have proper sanitization. Certain I can say that the certain judicial custodies have a proper kind of sanitization or health regarding or food regarding upliftment. But many, or I can say 80 to 90% jails does not have proper sanitization, does not have proper food food habits, or anything which is any kind of nutritional value. They lack nutritional value, they lack a proper level of sanitization. So why we were not giving concern to the prisoners? Some persons who are still in the jail, they are in trial procedure, they are in trial procedure. So they are not, they are only accused, they are accused of some kind of some kind of crimes, or they might have been through or in some kind of stages where they committed some kind of crime due to like grave and sudden fight or something like that. So we are ignoring this kind of category as well. We have ignored them. Like if you will go through the UN, one of the UN data, you will see that Iran, even in case of US, many prisoners were found with corona positive cases. Then afterwards, I guess in Bahrain, many of the prisoners were parole. They were given parole because of such reasons, so that their safety issues will be taken into consideration, because they are humans as well. They are also going through certain kind of trials. So in these cases we must look into that, if a person is living under certain kind of circumstances, what that person have done. Suppose a person was juvenile and he is under trial, and you are putting that person in so much unhealthy conditions. What will be the scenario, what will be the condition, or what will be the I can say outcome of that? So uh, uh, there are certain other domains as well which were largely affected. So as I have said, education sector, uh, family lives of everyone, because if you will see that human rights, in human rights, right to family, right to education, right to have a healthy environment, these all are part of our human rights. So there are many other issues which need to have a proper scrutiny or proper discussion, but as we don't have much amount of time, so I think this was a quick brief, or I can say this was a quick understanding on which you can ask any kind of question if you want to, or any other kind of additions if anyone wants to add on.
Thank you, ma'am. We have some questions.
Yes.
One question is from Law Speeches. Why India has not adhering to all provisions of UDHR 1948, though we claim one of the biggest democracies in the world?
I think the question uh, should be discussed by both the speaker, so that a
Yes, sir.
clear understanding will be given to all the participants.
Okay.
So I'd like to ask Sir Shahab sir to join this discussion also.
Yeah, I'm very much here. I was just waiting for Mr. Waraah to carry on. So please, yeah, ma'am, please carry on. Then I'll join you. Yeah.
Okay, so if you will go through, there are so many human rights domain, like refugees, on which I have done my master's thesis as well. So I have also of the same view that being a democratic country, a country who largely support the system, or largely I can say not support, I can say that largely claims to be a democratic system, uh, does not largely follows or does not accord to every human rights activities, or every human right convention. As we have refugee convention, we have so many other conventions. Like also, if you have been through the Vishakha versus state of Rajasthan case, previously we were not concerned about sexual harassment at the workplaces in regard to the women, but after this case in Vishakha versus state of Rajasthan, we were already recognizing the concept of CEDAW, which talks about elimination and discrimination of all forms against women. But Vishakha versus state of Rajasthan gives us it was a kind of eye opener, which gives us the values, which gives us the space to make a law on certain kind of point. Also, there are certain issues in regard to refugees which needs legislation, purely legislation on certain kinds of laws, because refugees are a vulnerable group, and India is having a large population of refugee groups. Also, in time of pandemic, refugees are suffering from human rights discrimination, because they are not having proper access to food, they are not having proper access to shelters, they are not having proper access to potable water, all these things. So there are many issues, various issues which need to be taken into consideration by our legislative system, because India claims to be a very democratic country, and being a democratic country, there are certain tenets which need to be followed, like transparency, accountability, and answerability. So for such reasons, I also just support this claim, or I can say I also support this question, that being a part of, or being a country who highly follows the concept of democracy must assure that its citizens or even the people living in its territory should be protected. Thank you.
All right, so
Thank you, ma'am.
now my turn. Yeah, I'm just going to take this turn myself. Okay, thank you. And I'd like to add, I'm quite satisfied with what Madam Ummul said. I'm sorry if you're Miss, so let me call you Miss Ummul. Yeah, sorry. Yeah.
Thank you.
So Miss Ummul,
Okay.
Assistant Professor Ummul has rightly pointed out a lot of things, right? Then I would like to add a few things, in what she has deliberated. It's like, there are a few other hindrances in our Indian, you can say, setup that actually prevents the UDHR to be, what the question is all about, like, to be followed in its letter and spirit. It's like, I would like to point out two or three things. Say, for example, first is the reforms, like our police reforms, that is very much awaited, and it's highly needed. Police reforms are there. Time and again, Supreme Court of India has pointed it out that the police reforms are very necessary and needed like anything. But still, since the police is a state subject as per our constitution, right? So the states have somehow, I would say, all the states have somehow failed. Some of the states have actually crossed some of them, you can say, marked points, but still the reforms are needed. So because of the police atrocities, what happens, somehow India is being seen as a police state in times of crisis. Say for instance, we saw 4 years ago, it was demonetization scheme of the government, or demonetization announcement, right? What happened? You see the kind of atrocity that we saw the police personnel were doing on those poor people. Not poor, everybody. Poor here means, I mean, with poor bechara, right? So even the person had a lot of money in the bank account and he wanted to get just 100 rupees note to get her kid a bottle of milk. He is just going to get, a lot of people got beaten by the police. So we saw the reports. Then second is our social fabric. Although Indian social fabric is very beautiful, it's all inclusive, yet with the changing times, our social fabric has also got decayed, I would like to say. Decayed. Say, for instances, I mean, we have seen the issues of cow vigilantes, right? Then rape, right? Because it's a male patriarchy system. So every day we are getting this news of rape and all. So all these actually activities, right? Rape and then embezzlement, and all these people who left the country after doing all these ghotala and embezzlement, they left the country. So all these things, directly and indirectly, they go to touch the issue of human rights, and that is grossly against the kind of guidelines given by the UDHR. That's why I think although India is in a better position than many other countries, but in its own entirety, India needs to bring some, and I would like to say that a little reform is needed, and for that a little political will is needed. Little political will do it. So I hope that very soon, we are going to get up to the expectations of UDHR, and very soon, I hope, I pray, and I believe that this question will be a matter of the past, that why India is not able to comply with the guidelines of UDHR. I hope I have answered the question satisfactorily.
Thank you, sir. The next question is from Saurabh Dubey. Adhering to Adhering to all the provisions of the Act will require an infrastructure which is crucial for implementation of the Act. The declaration in itself does not have an enforcement machinery. Okay, I think it's not a question, it was just a remark. Another question is from Diksha Tiwari. What are the remedies you suggest to prevent violation of human rights?
Okay, may I reply this?
Okay, sir.
Okay. Now the remedies are like, since we are talking, I mean, this particular lecture was all about the context of COVID-19. So I would like to say that remedies are very much on the way. So it's not like, because even the policies are being made and all these human rights policies, somebody has put a question. Okay, I'll come to this question. So with the policies, the solutions are there. The policies comes with the solution. So solutions are there, and there are long list of solutions. So I won't go deep inside those solutions and the list, but then solutions are there. the question, rather, I would like to say, with all due apologies, that it should be framed in such a way that in the present times, when these human rights violations are there, even when we have got solutions for it, so how to tackle with them, what happens to the solutions, whether the question should be like whether the solutions are not the solutions anymore, whether the remedies are not the remedies anymore. So this could be, I think, a bone of contention, or this could be, I think, a more better point to be asked. So, but as per the question, the remedies are very much over there. So you just need to turn the pages. I think we have got positive time. Otherwise, I would have enumerated a lot of remedies and solutions that have been provided by different conventions of human rights on the national and international level. Yeah.
Thank you, sir. Another question is from Sneha. It is estimated that at least one-third affected population will fall further below poverty line. How can one take initiative in such a scenario where Government of India is milking the public in the name of democracy?
I'm not clear about this question. Can you please once again repeat that?
It is estimated that at least one-third affected population will fall further below poverty line. How can one take initiative in such a scenario where the Government of India is milking, I'm not getting this word, milking the public in the name of democracy?
I got it. I got it. Milking means exploiting, So it's like here
Okay.
the seeker wants to know that when the government is exploiting the people, so how can one take initiative? So it's a good question, but I'd like to point out that uh, I don't want to put you in any kind of disparity, but for a chunk of 1.3 billion population, one person's initiative or two or three people or Hood Society's initiative is not going to work, right? So it's all about the policy. And yeah, it is true that presently the government is actually milking. I would like to I'd like to support this term. Today itself, the honorable prime minister has inaugurated the new parliament building that is going to incur for 1000 crores of that is going to be the expenditure, while a lot of people, and then these our kisan, our farmers, these people who feed us, they are on the roads, and they want just the kind of relief and packages, including some other things, but they want relief and packages the most, while the government is spending money to some other aspects and avenues which is necessarily not needed, because we have got a very good parliament house at present, so there was no need. This is what I think as a student of law, as a teacher of law. But then, so the question seeker has asked a very good question, and my point is that all alone you cannot do it. So what one can do is to, and this cannot be done overnight. Okay, so what one can do is to make people or aware people about their rights, so that gradually this can be achieved, because you cannot ask from the government and the government is going to give it to you in a plate or making it a platter for you, right? But yeah, it could be done. If you are not going to reap the fruits, your generation will reap the fruit. And once again, I'd like to put a share over here, like Iqbal says, nahi naumid Iqbal apni kashte veera se zara num ho to ye mitti badi zarkhez hai saqi. So it's a hardcore Urdu, but still it's like do not get despaired. I mean, try to work. And I'd like to point out the work that you people, that is the Hood Welfare Society people, are doing. It's also a kind of in the same direction, that you people are making aware the others, the general people, and then helping them. So this can also bring a lot of changes. Martin Luther King was alone, Nelson Mandela was alone, then a lot of leaders were alone, but then they were successful in bringing the revolution. So once you will start, so karwa banta hi jayega. That is the point. But akele it won't be possible. All right.
Thank you, sir.
Yeah.
Now, at the end, I would like to call Mohammad Wajid Khan, sir, for a vote of thanks.
Thank you, Aliza. Am I audible?
Very much.
Yes, sir.
Aliza, thank you, Aliza. A very warm good evening to all of you. As a convener of the event, I must begin my word with a share or a couplet of a legendary lyricist of Bollywood and Dada Sahab Phalke awardee, Majrooh Sultan Puri Sahab. and the few lines of the same has also been pointed out by Dr. Shahab sir. मैं अकेला ही चला था जानिबे मंजिल मगर, मैं अकेला ही चला था जानिबे मंजिल मगर, लोग साथ आते गए और कारवां बनता गया. Which means that I set off alone toward my goal. I set off alone toward my goal, but people came along and it began to turn into a karma. So as a convener, it becomes very difficult to organize any event, but with the support of the team, a convener can easily or successfully make any event a grand success. So in order to thank all the keynote speaker, panel speaker, and all the organizers and all the team members, I am here with this word. I begin with this word. So first of all, I would like to extend my heartfelt thanks to the keynote speaker of the international panel discussion, Dr. Shahab Shabbir sir, who is assistant professor of law in Maldives National University, Republic of Maldives, who has accepted our invitation within a very short span of time and devoted his valuable time to grace the event with his vast range of experience. So thank you so much, sir, for your wonderful gesture and the support and the cooperation that you gave to us. Secondly, I would like to extend my heartfelt thanks to the panel speaker of the event, Miss Ummul Waraah ma'am, who is assistant professor, School of Law, Galgotias. Actually, the term local and the Galgotias, these
Yes,
are coterminous, seems
Quite
coterminous. That's why I used to get confused, quite confused. So she is the assistant professor in the School of Law, Galgotias University, Uttar Pradesh, India, for dedicating her precious time for sharing her valuable experience on such an important discussion on the important day. I am thankful to you, ma'am, for your support and the cooperation that you have extended to my team. I am also thankful to all the organizers, particularly Mr. Akhtar Hussain, for working hard to organize the event. I am also thankful to Miss Asma Parveen and Miss Aliza Shahid for restless efforts and exceptional role to make this event a grand success. Thank you, Asma and Aliza. My heartful thanks also goes to all the team member of Hoot Welfare Society, particularly the technical support team, without which any online program cannot be a successful program. So my thanks also, heartful thanks also goes to them. Last but not least, any program cannot be a successful program without a disciplined participants who spent their valuable time and listen all of us patiently. So I'm thankful to all of you, all the participants, all the audience, my senior, my juniors, and my colleagues, and all the distinguished teachers to join this event. And in a very important discussion of international panel discussion, which is international panel discussion. So I am thankful to all of you for joining. Now this is over to you, Aliza.
Thank you so much, sir. Thank you, viewers. Thank you, speakers.
Thank you so much for joining, everyone.
Thank you very much. Good night, everybody.
Thank you. Good night.
Thank you, ma'am.
I think that all of us should be on screen so that there will be a snap for the record.
Yes, sir.
I request ma'am to join.
Yes, sir, I'm joining.
And, Aliza, can you take a snap?
Sure, sir.
Is this visible right now?
Yes.
Yes, ma'am.
Is it okay?
Done, sir.
Okay. Thank you so much.
Thank you, sir.
Thank you so much.